Welcome to this introduction to the GLASS project. My name is Eilish McAuliffe. I'm Professor of Health Systems at University College Dublin in Ireland, and I'm leading this project together with my colleague, Professor Henry Millell, who's Professor of Health Systems Management and Local Governance at Mzumbe University in Tanzania. In this brief video, I will tell you a little bit about the GLASS project, why it's important, and what we're hoping to achieve with it. So the project's title is Gendered Leadership, Advancing Systems and Structures, which we shortened to GLASS. GLASS being a reference to the glass ceiling or invisible barrier that many women face when trying to advance in their careers, a concept which I'm sure many of you will be familiar with. The project is funded by the Irish Research Council, and it is a collaboration between our two universities, University College Dublin, Mzumbe University, Poralg in the Tanzanian government, and the Health Service Executive in Ireland. The primary aim of the GLASS project is to address the organizational and individual barriers that women face when trying to advance to leadership positions in the Tanzanian healthcare sector. And we aim to do this by implementing an intervention that we feel will improve the likelihood of women being promoted to senior positions. We're also planning to evaluate the impact or influence of this intervention on leadership competencies and on career advancement in 3 regions in Tanzania where we're implementing the program. Why is the GLASS project important? Worldwide, 70% of the healthcare workforce is female. Women are the most frequent users of healthcare through their use of health services for antenatal care, obstetric care, childhood development, childhood vaccination clinics, and also through taking care of elderly or frail parents who may need healthcare. Yet we know that women are very underrepresented in decisions about healthcare because they're not in decisions. They're not involved in decisions about finance and allocation. They have very little input into health service design and delivery and into health service policies or healthcare improvement. An important report delivered by women led by men, which is a gender and equity analysis of the global health and social workforce, confirmed that women health workers are concentrated into lower status, lower paid, and often unpaid or volunteer roles within healthcare. So why is this project important in Tanzania? There's a very large gender gap in senior and middle management in Tanzania across all sectors. More than 80% of the senior and middle management positions are occupied by men. We also know that less than 1/3 of doctors in Tanzania are female. And this substantial underrepresentation of women in leadership and governance is slowing progress on gender and diversity goals. We can only achieve the Sustainable Development Goals if we achieve Goal 5, gender equality. And this was emphasized recently by Mary Robinson, who said if we took away barriers to women's leadership, we would solve the climate change problem a lot faster than we're currently doing. So what are some of the common barriers experienced by women? We know about many of these. Women tend to have a reduced capacity for work due to career disruption, for childbearing purposes, or external responsibilities and caring and family duties. We also know that there are differences in men and women in terms of their confidence and career ambition and their expectations about how their careers might advance. And female-dominated professions within healthcare, such as midwifery and nursing, are often undervalued and considered women's work. In addition to this, there are gender stereotypes in existence in most workplaces and gender communication differences, and these can serve as barriers to women. So gender inequity in healthcare leadership results in a loss of critical skill and expertise if women's voices are not at the table. It can result in low morale because women feel they can't influence decisions. It can result in increased costs of sustaining the workforce, and it can have adverse impacts on healthcare and healthcare policies that are affecting women and children. Some of the key activities of GLASS, one of the things we're doing is documenting the current leadership and gender in healthcare characteristics and barriers across 3 regions in Tanzania. And this we have achieved, the regions being Kagera, Kilimanjaro, and Njombe in the south. Using this information then to design a leadership program for women at the first level of leadership, that is heads of units or departments, facility in charges, and we've also achieved this. We have designed this program, and designing a novel mentoring program, which I'll tell you a little bit about now and why it's novel. So the GLASS mentoring model is different to the usual type of mentoring model, because normally when females are mentored within an organization, they tend to be assigned a female mentor. And in this model, we are assigning, yes, a female mentor, but also a male mentor who's a male influential leader within the healthcare system. And the reason for this is that we feel that men are in the majority of leadership positions in Tanzania, and therefore in the majority when it comes to making decisions about who's promoted to leadership positions. So they're important support to aspiring female leaders, and we need to give visibility to these females, to males, if they are to be considered in terms of promotion prospects. Some of the other activities of the project, we are delivering this leadership training that we have designed, and that's ongoing. We are implementing this novel mentorship program, and that's ongoing. And when we have completed these, we will evaluate the impact of the project. And finally, we will disseminate our findings through various fora. So what do we expect to happen as a result of the GLASS project? Well, I guess there are outcomes at different levels. For the mentees or the women who are involved in the program, we expect them to grow in their leadership skills and expertise and to become better networkers. We expect that their confidence will be improved and their morale increased, and that they will have increased visibility within the healthcare system. In terms of the healthcare system itself, we are hoping to mobilize support from male influential leaders through their involvement in the mentorship program. We are also hoping that this will increase awareness and will help in tackling some of the organizational and system barriers that women are currently encountering. And finally, we are hoping that awareness and better implementation of policies on gender equality will lead to more equitable workplaces in the Tanzanian healthcare sector, and that we will be able to produce an evidence-based intervention that can address the gender gap and can be scaled up across the Tanzanian healthcare system. Thank you for listening to this presentation, and thank you for participating and contributing to this program.